Hello guys. In this lecture we will be discussing about the ethical dilemmas which may occur or which may emerge during a dental practice and how to handle those situations. All of us are familiar with these five basic principles of ethics: patient's autonomy, beneficence to the patient, non-maleficence to the patient, justice, and the veracity. Dental Code of Ethics. Dental profession has a discipline-specific code of ethics, and these codes they describe the goals, aspirations, and subsequent ethical standards of the profession. When we look at the primary function of this professional code of ethics, it is to foster cohesiveness within the group, establish clearly defined expectations for conduct, and facilitate self-regulation among the members of that profession, those people who are following that code of ethics. These codes serve as a benchmark against which all members of a profession can assess the appropriate boundaries of ethical behavior. Significantly, the professional code of ethics represents the formal agreement that the entire profession enters into with society, delineating the principles and norms that it pledges to maintain. Professional ethical codes encompass the domains of individual moral rectitude, unwavering commitment, and principled conduct. Healthcare practitioners deeply value and revere the responsibilities that arise from pursuing and entering a learned profession. The mandated principles and ethical standards they serve to formalize and strengthen the importance of belonging to a distinct community of individuals who share the common values and objectives. Well, these codes they can be effective in shaping professional behavior. How? Firstly, when dental schools screen the applicants for admission to their educational programs, integrity and character are an important criteria for acceptance. Admission committees they strive to select those candidates who are best qualified academically as well as who are having good character. Then secondly, academic institutions, they actively strive to instill in their students the objectives and anticipated ethical behaviors of their respective profession. The acquisition of these professional expectations serve to fortify the character traits of aspiring professionals as they develop their careers. Students are introduced to the institution's code of conduct. They are also familiarized with the profession's code of ethics and professional conduct. And the faculty members, they are also serving as positive role models. In every dental school in North America, this white coat ceremony is being held. And that ceremony serves as a means of publicly and symbolically establishing the anticipated professional responsibilities and ethical behaviors. Then thirdly, upon entering professional practice, it becomes the responsibility of recently trained professionals to contribute to the self-regulation of their respective field. In the event that a member of the profession becomes cognizant of violations to the code of ethics, they are obligated to take substantive action to intervene. This duty is of great significance and must be approached with careful consideration as the reputation of the profession and the welfare of the public ultimately depends on willingness to actively engage in meaningful self-monitoring of the profession. Professional code of ethics we are discussing. The professional codes, they act as a benchmark that enables all members of a profession to assess the appropriate boundaries of ethical conduct. This is why being a professional is a privilege that comes with both the advantages, obligations, and duties that must be fulfilled to uphold the hallmarks of a genuine profession. The ethical code first emerged during the era of Hippocrates. So the history is quite old when we talk about the history of these code of ethics. Hippocrates was a Greek physician, and its influence from the Hippocratic traditions and contemporary writers is evident in modern day versions of the ethical codes. Traditionally, medical codes of ethics emphasize the physician's obligations pertaining to the one-on-one association between patient and physician, which encompass the duty to uphold confidentiality. Then authority and duty of beneficence, that is acting in the betterment of the patient. And finally, mutual obligations among the professionals. As a reciprocation for the authority and status bestowed upon professions, a code of ethics is a commitment made to the society to maintain specific principles and benchmarks in the execution of professional duties. Professional code of ethics are powerful ethical statements, but they are not legal mandates. Remember this thing. They are not legal mandates. Though these codes cannot easily be dismissed if there is a formal structure for self-regulation, licensing bodies, they follow these ethical statements. State boards or the provincial licensing authorities in North America, they can suspend or terminate a professional's right to practice in their jurisdiction if a person is not following these code of ethics. In case of lawsuit, these codes can also be recognized in the court of law. As previously we have discussed that these codes, they are not considered as legal mandates, but they may serve as a basis for evidentiary purposes in the court, where the existence of a fact that is generally known by the individuals of ordinary intelligence may be deemed admissible. Or we can say that legal proceedings may consider these commonly accepted information. During the Renaissance, some problems were identified in the old codes. Hence, the current codes were being written and they are now being practiced. So what happened in the old codes? Problems which were identified in the 15th century. A person is practicing without sufficient learning, which we call the untrained professionals or quack practitioners. Non-maleficence. This principle is governing. A person cannot practice medicine or dentistry or any healthcare profession if they are not properly trained, if they are not attended the dental school. Then prolonging treatment only for the personal gain. Now we call it over-treatment. Abandoning the sick, we call it abandonment. Revealing the secrets of patients, confidentiality and patient's autonomy comes on in practice over here. Fleeing in the time of plague. At that time there was a plague and practitioners, they just leave the patients and they were not attending the patients. Abandonment again. Charging the poor but overcharging the rich. Justice comes over here. Treating a patient while impaired or drunk. Non-maleficence. A code of ethics serves two main functions, as it is comprised of a set of principles that operate like commandments. First, it provides an enforceable standard of minimally decent conduct for those who fall below that standard. Secondly, it indicates in general terms some of the ethical considerations a professional must consider when deciding on the conduct. A code of ethics can and does serve as a tool in the function of self-regulation. Well, while the application of professional codes in the healthcare is valuable, but it has certain constraints. Ethical codes may not cover every possible scenario or provide comprehensive explanations in an accompanying interpretation. Additionally, it has been observed that the majority of codes emphasize the responsibilities of healthcare professionals rather than outlining the entitlements of healthcare recipients, means the patients. To bridge this gap, a patient's Bill of Rights is currently employed in healthcare environments as an endeavor to address this disparity. Dental Code. The principles of ethics and code of professional conduct of the American Dental Association serve as the code of ethics for dentists, and the association's Council of Ethics, Bylaws and Judicial Affairs is responsible for maintaining and updating it. Dental profession has a code of ethics since 1866. The initial version being a simple statement that emphasized the dentist's responsibility to meet the needs of patients and fulfill their obligations to them. It was stated in that the dentist should be ever ready to respond to the wants of his patients and should fully recognize the obligations involved in the discharge of his duties toward them. Similar to medicine, the dental code also underscores the importance of prioritizing the patient as the central focus. The introduction to the code begins with the statement that trust is special and critical to the position that dentistry holds within the society. The code mentions the profession is granted privileges and that in return the profession will adhere to high ethical standards of conduct. The preamble reaffirms the duty of dentists to prioritize the well-being of their patients, underscoring that the qualities of a professional, including knowledge, skills, competence, and character traits, they define their practice. Dental code we are discussing. The ADA code is divided into three components. The principles of ethics, which we have already discussed and we will discuss in detail over here. Then code of professional conduct and advisory opinions. The principles of the ethics component set out the aspirational goals of the dental profession, which are similar to the aspirational goals for other healthcare professions. The code is based on the 5 fundamental principles of autonomy, beneficence, non-maleficence, justice, and veracity. Well, when we look at these in detail, what happens with, what are the topics which are addressed under these headings? Patient autonomy, patient involvement and the patient records, non-maleficence, education, consultation and referral, use of support personnel, personal impairment, blood-borne pathogens, patient abandonment, and personal relationship with the patients. All these topics are addressed under this section. Then, under beneficence, community service, government of a profession, research and development, patents and copyrights, abuse and neglect, professional demeanor in the workplace, all these topics, they are covered under this principle. Then comes justice, patient selection, emergency service, justifiable criticism, expert testimony, rebates and the split fee, etc., etc. They come under justice. And finally, veracity, representation of the care, fee, disclosure of conflict of interest, devices and therapeutic methods, professional announcement, advertising, name of practice, announcement of specialization, general practitioner, announcement of credentials. All these they come under veracity. The portion of the ADA code that addresses conduct for dentists, the Code of Professional Conduct, delineates conduct that is either required or prohibited. Each section of the Code of Professional Conduct is followed by an advisory opinion. These opinions expand on an issue and often include legal warnings or suggestions for the dentist to seek further information or advice. Guidance is provided in the ADA code for anyone who believes a member dentist has acted unethically, and the code further explains that censure or suspension can result from a fair hearing on any unethical conduct. Ethics and the dental profession. The dental student learns about the ethical and professional responsibilities in various formal as well as informal ways while they are attending the dental school. The content of ethics and professionalism is mandated by CODA in the predoctoral dental educational curriculum. The Commission on Dental Accreditation, Dental Standards, Standard 2-20 related to ethics states that graduates must be competent in the application of the principles of ethical decision making and professional responsibility. Part of that education process is learning and applying the code of ethics. Dental education programs have two primary objectives when it comes to ethics. Firstly, to equip students with the ability to identify ethical concerns, and secondly, to instill in them a sense of obligation to take appropriate action when faced with the ethical dilemma. Ethical dilemmas, they emerge in the dental practice, and if we are not trained how to tackle these situations, what are the strategies for sound decision making, we would be having a lot of stress. Ethical decision making model. In professional practice, dentists may encounter ethical challenges when they are faced with competing obligations. Such challenges require careful considerations of various options, often without a clear-cut right or wrong answer. Decisions are typically made within the context of various factors such as professional, social, and economic pressures, which may sometimes contradict a professional's values and principles. Determining how to address ethical dilemmas can be a straightforward task, or it could be a very difficult one. Hence, having an ethical decision-making model in place can greatly aid in the process of making such decisions. Since 1989, when the American Dental Education Association, ADEA, introduced guidelines requiring dental schools to incorporate ethics into their curricula, it has been recognized as one of the important components of the education of dental healthcare professionals both in USA as well as in Canada. The objective of these guidelines is to equip students with the capacity to apply ethical principles to contemporary problems and emerging issues in the dental practice. These curricula aim to instill in dental students a sense of dedication to the moral principles that form the foundation of this noble profession's obligation to society. Additionally, students were trained to adopt a perspective that ethical decision making is a lifelong process and you are committed to continuously learn about it. The policy of ADEA to incorporate ethics in the curricula has undergone revisions since its inception. in 1989, as we have already discussed, including broader statements on professional conduct, societal responsibilities, access to care, requirements, and community service. Given that intellectual and clinical competencies are indispensable in providing oral healthcare services, hence it is imperative that educational curricula incorporate content on ethics and professionalism. A healthcare professional's perspective can be influenced by numerous factors like their age, educational background, training, family background, personal experiences, religious beliefs, culture, and the societal norms. In decision making, healthcare professionals should guided by their professional responsibilities and obligations, which prioritize the best interests of patients in the diagnosis as well as in the treatment process. Given the uniqueness of every single patient, a careful and thoughtful evaluation of each case is necessary when determining the appropriate course of action. While we will proceed and when we will be dealing with such cases in our practice, we will be coming across certain terms. And what are these terms? Let's discuss those. Ethical analysis. It is an ability to systematically apply ethical principles issues in the healthcare. Ethical dilemma. Competing obligations may arise when there are two or more possible options available to address a situation, and one has to resolve such a situation depending on a moral evaluation rather than solely on their clinical skills as well as on their scientific judgment. Moral courage, showing the courage and fortitude to address an ethical problem found in the practice of healthcare. Moral distress, the feeling of being dejected, being powerless and frustrated when unable to act in accordance with the ethical principles and norms. Moral sensitivity, it is an ability of a professional to be aware of ethical issues. Moral uncertainty, ambiguous situation, being uncertain whether a moral obligation exists and what is its scope. Moral weakness, a situation where obligations and responsibilities direct towards one course of action, but personal inclinations or preferences point towards another direction. Well, when there is a problem and a person is having a feeling that, and they know that something is wrong, but they are not aware how to correct that in the workplace, or if some colleague is not working in accordance to the ethical principles, the person goes through the moral distress. This term addresses such situations in which the healthcare professional is frustrated from feelings of powerlessness when a perceived wrong is occurring, but they are unable to act. This is experienced by a professional when they cannot do what they believe should be done because of some system issue. Influence of a powerful person or maybe other restraints in the situation. The use of this term has been adopted from the nursing profession to describe situations in which the nurse feels powerless to act ethically. Usually, those nurses who are working in the critical care. This is a relatively newer term. The resulting distress, emotional toll, anger, guilt, and depression are familiar to many healthcare providers who must balance conflicts of conscience with professional expectations. An example of this for the dentist could be when treatment recommended by another provider for a patient is deemed excessive or unnecessary. To deal with this distress, several tools have been created to help a clinician process through this type of situation. How to get out of this situation in a win-win situation. Well, as I told you earlier, that this moral distress most commonly occurring to the nurses, and they actually identified it quite early before us. The American Association of Critical Care Nurses advocates a model for rising above moral distress called the 4 A's. The 4 A's are ask, affirm, then assess, and finally act. So in this way, they would be able to create the healthy environment in the workplace. Now, what is this ask, affirm, assess, and act? Ask about the problem. If you feel that someone around you, you are a team leader, and you feel that a person's working capability is not good, or they look a little bit kind of going through some stress, then the team leaders should observe for signs on moral distress on their teams, and if unsure, ask the team members. Be aware of situations around you that may be affecting you or others. The goal is to identify when it is present. Then affirm that you are in distress. If you are going through it, that you have a professional obligation to act to your team leader. Or if you are team leader, after validating that one of team member or members are having moral distress, make a commitment to address the concerns and affirm the professional obligation to act ethically. Then assess. Identify sources of distress and analyze risk and benefits. Team leaders assess the extent of the problem causing team members moral distress. What are the risks and benefits of taking action to reduce the moral stress? And if there are some roadblocks, there are some hurdles in taking the action. Then act. Prepare to act both personally and professionally. At this stage, the leader should begin to initiate change that is needed to reduce the moral distress. Dealing with the moral distress. Professionals who possess moral courage are encouraged to persist in upholding their principles even if it entails standing alone in their beliefs. In his guidelines for either decision making, for this ethical decision making, J.S. Murray, one of the authors, outlined 7 pivotal checkpoints. These checkpoints commence with an assessment of the necessity for moral bravery and conclude with steering clear of factors that could impede the moral courage. These are the Murray's guidelines. Evaluate the circumstances to establish whether moral courage is needed in the situation. Determine what moral values and ethical principles are at risk or in question of being compromised. Ascertain that what principles need to be expressed and defend in the situation. Focus on one or two of the more critical values. Consider the possible adverse consequences or risks associated with taking action. What could be the worst? Assess whether or not the adversity can be endured. Determine what support resources are available. Avoid stumbling blocks that might restrain moral courage, such as apprehension or other reflection leading to reasoning oneself out of being morally courageous in the situation. Continue to develop moral courage through education, training, and practice. These are the 6 steps which are crucial in your decision making. First of all, identify a problem, whether a problem is present or not. Then collect the related information. Then state the options which you have in order to correct the problem which is present. But apply the ethical principles to the options. Then make the decision, and finally implement the decision. Step 1, identify the ethical problems or dilemma. This is the most critical step. If you are not aware of the problem, you won't move further. In clinical practice, many problems are not perceived as ethical dilemma. That is a major issue. After acknowledging the issue, the decision maker should express the ethical dilemma in a concise and unambiguous manner, considering all relevant facets of the problem. If the ethical query does not create a clash with the principles of ethics, discerning the right from wrong becomes quite straightforward, and the need for an ethical decision-making process does not have any place. But if there is a clear-cut judgment has been reached, there is no need to move on to step 2. If the clear-cut, whether you have to do this or you have to do that, then there is no need to move on to step 2. Step 2 is collect the information. The decision maker should collect all the relevant information to take an informed decision. The information could be about the situation as it developed, or it may be coming from more than one sources. Patients' medical and dental history is also required in case if a patient is involved. And usually in these conditions, patients are involved. What are the expectations of patient in regard to their treatment and if they are attainable or not? Also identify if the patient has a capacity to take decision or not. Like a 16-year-old teenager may be having a capacity to take decision on their behalf, and maybe a 65-year-old person suffering from some dementia won't be having a capacity to take decision for themselves. So we have to discuss the situation with their caregiver or with their children or spouses or whoever the legal hire. State the options. After gathering necessary information, move to the third step where all the alternatives and possible options will be considered. Usually the optimal decision is not the initial one that comes in your mind. There is a predisposition to assume that a question has only a single answer. No, it is not. There could be many different options. This stage necessitates halting and looking at the situation from various perspectives to identify alternative solutions that others may perceive as viable. An open and receptive mindset is crucial to acknowledge that there may be more than one solution to a problem. Then, step 4, apply ethical principles. You have enumerated your options. Now see if your options they are fulfilling the ethical principles or not, or they are in conflict to the ethical principles. So while considering the options and alternatives, be focused on the ethical values and concepts such as confidentiality, informed consent, and paternalism, along with the ethical principles of autonomy, beneficence, non-maleficence, justice, and veracity. Usually, one or more than one would be involved in decision making. Enumerate the impact of each alternative on ethical principles or rules by creating a comprehensive list of advantages and disadvantages. In the benefit section, include options that safeguard or uphold each principle or value. In the drawback section, specify how an alternative may transgress a principle or value. This process should be carried out for all available alternatives. This step will help in identifying those principles which are in conflict to the situation and options available to sort that situation. Step 5 is make the decision. When each alternative is weighed on ethical principles or rules, with an understanding of their advantages and disadvantages, each option must then be considered turn by turn. Doing this, be focused on the advantages and disadvantages of each decision. The seriousness of the disadvantages must then be weighed by the clinician, keeping in view the best interest of the patient. By examining the options carefully, the best solution to the situation will emerge vividly. Before implementing a decision, test your decision with each principle of ethics to rule out any conflict. And finally, implement the decision. No matter you are going in the opposite direction of whatever the other colleagues are doing. But if your decision is right and is according to the principles of ethics, then implement the decision. Final step is the implementation of the decision. If an action is not taken, the whole process would be an exercise in futile. Taking an action requires moral courage. In most of the situations, this step is omitted, hence many appropriate decisions, they are not being implemented. If no action is taken, it is considered that you have approved the situation. Jensen's 4-box model. This model was developed by doctors Albert Johnson, Mark Sigler, and William Winslade. It is particularly helpful when dealing with complex medical cases. The authors describe this framework as an ethics workup similar to the history and physical when first assessing a patient. This approach organizes and displays the relevant data and questions in a 4-domain arrangement. The 4 boxes, quadrants, or paradigms are medical indications, patient preferences, quality of life, and contextual features. So let's see medical indications, the autonomy, beneficence, and patient preferences, autonomy. Consider the medical conditions, diagnosis, prognosis, and interventions. Here, does the patient have capacity? As I told you earlier, a 16-year-old would be having a capacity to take this decision on their behalf. Or maybe a 65-year or 60-year-old who would be having a compromised health, especially the mental one, they won't be in the capacity. So firstly, determine the capacity and then see what are their wishes. The quality of life, autonomy, non-maleficence, and veracity. The contextual features, justice. So consider the patient's quality of life from his/her view, and what are the social, cultural, legal, economic, and institutional circumstances. Are you going to follow those or not? Ethical decision-making model. Evaluating the significance of facts, opinions, and circumstances when dealing with intricate ethical dilemmas can be difficult and bewildering process. An ethical decision-making model framework can offer clinicians a method for tackling with such situations. It provides an approach to problem solving. Categories of ethical dilemmas. This list provides the general categories that have been acknowledged as ethical dilemmas in the dental literature related to ethics. And those who are taking these board exams, like the cases which are presented to you in your exams, they would be falling under these categories. So let's see: breaches of confidentiality, failure to disclose dental mistakes, over-treatment and poor quality of dental treatment, requests for fraudulent documentation, requests for narcotic medications, requests for inappropriate treatment, deceptive dental marketing and advertisements, impaired or dishonest colleagues, challenges with capacity and informed consent, conflict or unethical behavior among clinicians, challenges arising from management, finance, or legal issues. Now let's discuss a case scenario, and keep in mind it is just a hypothetical one I just created for the educational purpose. It is not some person's actual case. Any kind of if you like you find it related to someone, it is just a coincidence. It is not some real case. So a case scenario: a 9-year-old boy is brought to your office by her mother. He has pain in his left lower jaw. Upon examination, you found out that he has grossly carious left first permanent molar, which is causing him severe pain. On further examination, you saw multiple caries in his mouth and no dental work was ever done in his mouth. Upon inquiry, both mother and child denied seeking any dental advice in the past. Patient's oral hygiene was not very good. Patient can communicate nicely in English, but his mother has problem in communicating in English language. Upon further inquiry, you realize that they are recently immigrated from some East African country almost 4 months ago. The first impression comes that it looks like a case of neglect. But on the other hand, when you communicate with the mother's personality is very pleasing and she appears very concerned about her son's condition. Your dental assistant says that it seems to be a straightforward case of neglect and we must call the Child Protective Services. You also feel that this condition falls under the definition of dental neglect. To this situation, let's apply the ethical decision-making model and come to a conclusion. Step 1, let's identify the ethical question. Should I report immediately to the Child Protective Services? Is it a case of dental neglect or case of ignorance about the dental health? How should I deal in this situation both with the child as well as with the parent? Now we will start collecting the relevant information. First of all, determine how long ago they have been immigrated to the country where you are practicing. The child otherwise looks happy, healthy, well-adjusted and active, which does not show any neglect actually. Upon further inquiry, mother tells that in her country, dental services are not very frequently available and they are very expensive as well. She herself never been to a dentist and her husband had only one tooth extracted, that too in emergency, which he never got replaced. Mother seems very much involved in the well-being of her child. She cooks and takes care of the family well. Another concern is if you report the situation, the Child Protective Services will take at least a week or maybe more to respond because this is not an emergency issue. Now, let's enumerate our options. Treat the child, call the Child Protective Services and report the case of dental neglect. Another option is call Child Protective Services for further information and guidance what to do in such a situation. Wait until the next visit for further treatment. Monitor the future appointments to assure that parents are not neglecting child's need for oral care. Means they are bringing the child on the scheduled appointment or not. And if they fail to do so or they come with some lame excuses, then we will again reconsider our options. Start educating the mother about dental diseases and their prevention and why regular dental visits are mandatory even for herself as well as for her family. Now, finally, step 4. Apply the principles of ethics to your options. Firstly, treat the child as they visit you for treatment. Acknowledging means autonomy of the parents to choose for their child, who is definitely quite young, to take the decision. Call Child Protective Services and report the cases of dental neglect in the child. This option is satisfying the principle of non-maleficence. You would be removing the harm, as dental diseases are harmful for an individual. It also serves veracity, as it would also meet the legal statute for reporting negligence. Call Child Protective Services for information and guidance. This option would be satisfying the principles of beneficence, because you are seeking advice. This treatment is quite expensive, and whether the mother would be able or the parents would be able to afford or not. So determining how to restore oral health to these children, this type of children, especially if the treatment is costly, it could also meet the intent of the legal statute. Wait until the next visits for further treatment. Monitor their next appointments to assure that parents are concerned about the oral care of the child. This option would be honoring the principles of autonomy, respecting the mother's understanding and choice for care for her child. Start educating the mother about dental diseases and importance of prevention. This option would honor beneficence, educating the mother and child about oral health. It would also acknowledge justice, as this was new information to the mother, having come from a culture that did not understand or possibly value the oral health. Step 5 is take the decision. Well, wait. In the present scenario, the best option is wait until the next visit for further treatment. Monitor their next appointments to assure that parents are concerned about the oral care of the child. This option is start educating the mother about dental diseases and importance of prevention. Should also be a part of ongoing treatment plan, as it will improve their lifestyle as well. Implement the decision. So what would be our decision? Start the treatment and do the necessary for the first appointment and reschedule the patient for further appointments. So what would be the necessary for the first appointment? Make the child pain free, because they are here for the pain, and start educating mother. Reschedule them so that they will come back, and whatever is necessary and required in the subsequent appointments, that is going to be done. This decision making, well, it requires analysis of a case, or analyzing a case like this, as we have done already, would result in additional thoughts, suggestions, and options. We are familiar with these 6 steps, but at times information can change, requiring the clinician to reframe the initial question and begin again based on the new facts. As I told you, we will wait in this case till the mother will bring the child back for the subsequent appointments or not. So if she comes back, we are going in the right direction. If not, then we have to again find out what is the problem and act accordingly on these steps. So over here we are done with this lecture. Hopefully you liked it, and I will come back with other hypothetical cases for your help, and hopefully you will get some answers to certain situations which many people who are approaching me and they are getting confused with. So inshallah we will do that, and hopefully things would be getting better. We will try to analyze these cases and we will come to a conclusion for these cases. Thank you very much.